welcome everybody, and it's another edition of Ask Cheryl. Today I have a welcome guest, Patrick Moore. He's a naturopathic doctor and he's also a nutritionist. And our subject today is going to be a naturopath's approach to diabetes. Now, Patrick is a nutrition scientist with an extensive background in nutritional and botanical medicine. He has studied alternative medical therapies around the world and trained under prominent nutritional scientists. Welcome, Patrick.
Thank you, Cheryl.
Okay, let's get straight into it. What's your opinion on the health of in the health of Americans today?
A disaster. In one word, it's a disaster. I see our culture disintegrating from within. One needs not look very far around our culture and see the dramatic increase in obesity, weight problems. You know, I look at the CDC report that said all children born in the year, about 1/3 of children born in the year 2000 will develop diabetes in their lifetime. Right. And just last week, the Robert Woods Johnson Foundation came out and said by the year 2030, 50% of America will be obese. Never before in the history of the human race have we seen anything like this, where a culture and a country are going to have 50% of their population, not just overweight, but obese. Mm-hmm. And the ramifications of that are dramatic because we're already hard-pressed with our health care system and the cost of it. Right. And the cost of treating diabetes and these weight problems is just going to cause just so many problems for our society.
Okay, give a breakdown. I mean, everybody's heard of diabetes and everybody has a different opinion on diabetes. Tell us what exactly diabetes is. We've got type 1 and we've got type 2, and I understand type 2 is the one that's prevalent and has exploded beyond belief.
Well, type 1 was normally known as juvenile diabetes, and that is where you are unable to produce enough insulin to deliver blood sugar into your cells. Mm-hmm. Interestingly enough, it's considered an autoimmune illness. Right. And there are countries that have done something about it. Dating back to the 1960s, Finland and Holland went on a program where every infant born was given 2,000 units of vitamin D. And right. Vitamin D helps to regulate our immune system. Right. And they found over a 30-year period no toxicity with 2,000 units of vitamin D given to infants and an 88% reduction right. in juvenile diabetes, which is dramatic.
Is that when they're born?
Yes, when they're born, at birth.
Right.
No toxicity, and it's a dramatic insight because vitamin D deficiency has been implicated in all autoimmune diseases such as multiple sclerosis, Crohn's disease, lupus, and ulcerative colitis, and all the others. So there is a dramatic relationship between sunshine, vitamin D, and autoimmune and juvenile diabetes 1.
So why is it not happening over here?
You know, why are things happening in China and not happening in America? Because right. sometimes I think America thinks they know best, and they
right.
don't.
Right.
And, you know, as a naturopath, I try to look back into nature and to our ancestral wisdom. And one of the things I've noticed, you know, we're trying to differentiate these two diabetes. Diabetes 2 is where the body is resistant to insulin, or else it's not making enough insulin. So we have a problem with metabolizing our foods. Mm-hmm. But one thing I've noticed, one of the major changes when we talk about vitamin D is, you know, in the last, if you go back to the year 1900, Cheryl, mm-hmm. diabetes was rare. Right. Cancer was rare. Heart disease was rare. Right. And what's changed in our country? One thing that is, in the last 50 years, we've been told that the sunshine is bad, it's harmful, it's deleterious to our health. So we have a society now that is hibernating. Right. You know, right. We're hiding from the sun right. out of fear of maybe a little skin cancer. And I think that's been very detrimental because vitamin D plays a major role in terms of helping us to produce insulin and also inhibiting insulin resistance.
Okay, do you think there's anything wrong with the way that diabetes is being treated today?
Totally, totally. The nutritional information traditionally is, okay, low-fat, complex carbs. Mm-hmm. This has never happened before in the history of the human race, where we removed and demonized fat. Right. Okay. Right. We've demonized cholesterol. We demonize saturated fat right. as if these are the bad people. Right. We go into the supermarket, it's no fat, low fat, light. So everybody fears fat because fat is supposed to make us fat. Right. But what's happened in the last 25 years, as we followed this advice and reduced our fat intake by 25%, people have gotten 25, 30, 40% fatter.
Right.
And so it's a basic misunderstanding of the importance in fat. There are bad fats and good fats, but therapeutic fats and bringing them back into our nutrition plays a major role in inhibiting the formation of diabetes.
Right, right. So what's the major, could you break down, simplify the good fats? Because a lot of people think, well, what's good and what's bad?
Yeah, first of all, let me look at the three food groups, fats, carbohydrates, and proteins.
Right.
A lot of fats and proteins are together in nature.
Right.
So if we remove the fat, we're also removing a lot of protein.
Right.
What's left?
As in like in steak and...
Exactly,
yeah.
carbohydrates. In fact, last night, just in case you asked that question,
Right.
I wrote down a number of fats that I could find around my kitchen.
Right.
Any type of fish. Fish contains protein and fat. And one thing about these three food groups is, and this is the key, fat has a neutral effect in terms of the secretion of insulin. I can't emphasize that enough.
That's true.
Fat stabilizes blood sugar.
Right.
And it normalizes a lot of our brain hormones, such as ghrelin and leptin, adiponectin, CCK, all these fancy names. Fat shuts down our hunger.
So when you're eating the low fats, you're more hungry.
When you lower fat content, you're not getting satisfied. Fat makes food taste better.
Right.
All you have to do is go to the country of France,
Yeah.
where saturated butters and fats and whole fat dairies. I mean, when I lived in Paris for 5 months, and the only fat people I saw in Paris were American tourists.
Right.
And I said to myself, well, the whole basis of French cooking is butter.
Right.
Aren't these people supposed to drop dead from heart
Right,
disease,
right.
diabetes,
Right.
cancer?
Right.
Aren't they supposed to get fat? They didn't get fat because fat shut their appetite down and stabilized their blood sugar. So I think we've got it wrong here, where we tell all these patients to go into a low-fat, complex carb diet, and they're always hungry. They're not being satisfied, and they're constantly in a position where they're secreting insulin, and insulin is a fat storage hormone.
What about the fats they're transferring it for? Instead of the saturated fats, they're going for trans fats,
Yeah.
which I've read are just not healthy at all. In Europe, they're just not popular.
Well, let's take a look, to get back to your original question, fish, protein and fat, healthy, those are healthy fats. Chicken, turkey. Two areas of controversy, dairy and eggs.
Right.
And I like to say that eggs are probably the healthiest food on earth.
Yes, I agree with you.
Okay, we've been demonized. I mean, I have a mother-in-law who's cutting up the eggs and discarding the yolk. And we have doctors who are going around telling people, oh, well, maybe one egg, and then get rid of the rest of the yolks.
Right.
It's a total misunderstanding. And in a way, it's bypassing our ancestral wisdom.
Right.
We never had this situation for thousands of years where people were cutting and splicing an egg
Right.
for fear of cholesterol.
Right.
The best thing you can do to control cholesterol actually is to eat food with cholesterol in it.
Right.
Because dietary cholesterol turns off the inner production of cholesterol in our body.
Because what a lot of people don't realize is you actually produce a lot of your own cholesterol.
The body is self-sufficient in producing its own cholesterol, but if it's not getting cholesterol is a survival molecule.
Yes.
It plays a major role in terms of building up our immune system and producing all our hormones. I've been teaching nurses at Yale New Haven Hospital for over a decade now.
Right.
And when I tell them that, the whole structural foundation of estrogen, progesterone, testosterone,
Right.
cortisol, other hormones called DHEA and pregnenolone, you build them with cholesterol.
Right.
And when you interfere with the cholesterol mechanism, you can throw all of those hormones off balance.
Right.
And so if you take a simple egg, people cut it up, but they don't realize that 43% of the protein is in the yolk. And when it comes to the fat, 70% of that fat is monounsaturated, which
Right.
is the same component you would find in olive oil.
Right. Right.
So, and the same with dairy. I mean, a recent study has come out, because I look at the school systems in New Haven, and everyone's gone to 1%
Yes.
milk or
Yes.
skim milk.
Yeah.
It tastes awful.
Yes.
What did the Bible say? Take me to the land of
Milk and
skim
honey.
milk?
Yeah, milk and honey. Milk and honey.
No,
Yeah.
we didn't refine our
No.
milks. And what they discovered is the fatty acids in milk reduced diabetes risk by 60%.
Right.
This is Harvard School of Public Health. 60% reduction in the risk of diabetes by taking in these whole fats in milk called trans-palmitoleic acid. In addition to that, what they also found in their research is that it reduced insulin resistance, it lowered inflammation in the body, it helped with body weight composition. So again, sticking with nature and our ancestral wisdom can be very beneficial, and trying to, instead of thinking we're smarter than nature, we're more arrogant and we have to devitalize foods and refine them.
So if all these studies are out, why are we not utilizing them?
Good question. We have thousands of studies on the therapeutic benefits of vitamin D and how it can affect our immune system and help prevent high blood pressure and help to alleviate autoimmune diseases, and it's one of the most powerful anti-cancer nutrients on earth. One of the reasons is you can't patent any of these things.
Right,
you can't make money off them, and in an American system, we're always looking for prescription drugs, chemicals to patent and make money. We also, for example, for the sun, how many sun salesmen are out there knocking on doctors' doors and talking about the therapeutic benefits of sunshine and vitamin D? It doesn't exist. So, I mean, that's part of our capitalist system, and you know.
So briefly tell me, how is diabetes being treated today?
Well, again, from a food standpoint, go on a low-fat diet. And that destabilizes your blood sugar when you do that, because you're going to end up defaulting into lots of carbohydrates, which are always stimulating insulin. And insulin is a fat storage hormone. After a while, your cells are going to say, in Spanish, no más. I've had enough of this influx of sugar and I don't want any more, so it has to go somewhere, so it's stored as fat. As far as medications, I mean, they can have some benefit, but I'd like to cite the Accord study, which was December 17th, 2008 in the New England Journal of Medicine. What they found was that the aggressive medication treatment of diabetes increased the rate of diabetic deaths by 22%. And then when they tried to normalize and improve HDL, it had no positive effect on heart health. And then another thing is when they tried to address elevated blood pressure, they found that diabetics actually did better when their systolic blood pressure was in the 130s. Because of impaired circulation, they need to push that blood nutrients and oxygen through their body. So it's very troublesome. I've had diabetic patients who are on insulin and all they do is get fatter and fatter. And so I think it's counterproductive. It doesn't get to the root cause as to why it's happening in the first place. It's more of a Band-Aid approach, so you get a good lab number, but you're not actually improving the inner health of the patient.
There's one treatment which is becoming more popular, which I totally disagree with, I don't like, and that's lap band surgery. Because they're saying, well, you know, obesity leads to diabetes, so, you know, they can't lose the weight, so let's give them the lap band surgery. And they're giving it to younger and younger people, you know, some teenagers even. I totally disagree with it, but because I really believe that they should go for the diet approach and the natural approach, but it seems to be getting more and more popular, you know.
Well, it's a quick fix society, and perhaps if you're, you know, 400 pounds and you're ready to burst with a stroke, heart attack, perhaps it has some merit. But I think we're always looking for the easy way out instead of, you know, physical fitness, modifying the food plan, and nutritional medicine. Nutrients can play a huge role in helping to inhibit diabetes and to treating it.
Now, they're saying, you know, doctors are saying that you don't need to take supplements because you get all the nutrients from your food. If you eat the right foods, you get all the nutrients from your food. So the supplements, you're just peeing it down the drain, basically. So what's your take on that?
Well, this is a reflection on our medical system where medical doctors in their education, basically, they have zero education on nutritional biochemistry, nutritional endocrinology, or nutrition per se, or on supplements and nutritional medicine. So this stuff is regurgitated like parrots over and over, and it couldn't be farther from the truth. I mean, if we just take certain supplements like, again, vitamin D, and I'll refer to a few studies here. The UCLA School of Medicine, Dr. Ken Chu, when he raised vitamin D levels and normalized them with patients, you had a 60% reversal in insulin resistance just by doing one thing. Now, how are you going to get your vitamin D up? You're not going to get it from milk. That's only 100 units. You're just not going to get it in food. These same doctors have told us to hide and hibernate indoors because the sun is evil and bad, so you're not going to get it from natural sunshine. So supplementation plays a huge role. Another nutrient is magnesium. Magnesium to me is a magical mineral. It's been processed and demilled out of most of our foods, and Tufts University did all the studies, and it plays a magical role in terms of reversing insulin resistance. So there are a lot of nutrients like that. Chromium, zinc, these are all milled out. When we refine our foods, our wheats, we take 44 nutrients out.
Right.
And then we replace them with a few synthetics, 6,
Right.
7, 8. Another problem is our soil. We milled the soil so much and tilled it so much, we're not getting the same nutrients we were from 1960 to the year 2000. All the
Right.
studies are out.
Yeah.
Vitamin C in spinach has been reduced by 60%. And, you
And
can
have
go,
they changed the recommendations on the amount of spinach you need to eat to get, your vitamin C?
no,
Okay.
no, not at all. So this has been really misguided. And people usually do what they have confidence in. And if you haven't been in clinical nutrition and nutritional medicine, which these doctors have not, they don't have confidence in it.
Right.
So they just regurgitate these same type of myths, and it's completely false.
Right. Okay. Tell me some of the side effects of the health consequences of diabetes.
Oh my goodness. It's probably, it's a massive oxidation of the body producing free radicals. And oxidation, basically, it's rusting all of our organs because of all this sugar floating into our bodies.
Right.
It breaks down our cells. It's the leading cause of amputation, as you know, in neuropathies and nerve damage, leading cause of blindness. It promotes heart disease, which promotes strokes and elevated blood pressure. It plaques the arteries, weakens the kidneys, dialysis, premature death.
Right.
I mean, it's something that, again, it's not part of nature.
Right.
People in the past, diabetes did exist, but it was rare.
Right.
So it's a mechanism that, there's something we can do with our interventions, and, it's something that at this point is impairing our medical care system and will even more so in the future.
Right. So if we just handle diabetes, because diabetes by itself, as much as it's a serious illness, it goes along with all the other consequences you said, like cholesterol, heart attacks, because that's the number one killer of diabetics. Is that true? Heart attacks or strokes, heart problems, heart complications.
It's all up there, with heart disease.
Right.
And so I don't think cholesterol plays a major role. I
No.
mean, I have a totally different opinion on that, because
Right.
cholesterol to me is good.
Yeah.
It's something we need for all our structural production of our hormones. And I'm always curious where the same amount of people die or have heart attacks if they have a cholesterol over 200 and under 200. There's no difference.
Right.
And I'll cite Dr. Michael DeBakey, who was the greatest heart surgeon in the history of our country. He died at age 99.
Right.
Everybody from around the world came to his clinic in Houston, and he supervised heart surgeries up till age 96. He thought this whole cholesterol thing was a total myth.
Right.
And he found that 80% of his patients with plaqued arteries had normal cholesterol.
Right.
And by the way, he ate 2 eggs and bacon for breakfast every day.
Right.
So I think this is vastly exaggerated, this whole cholesterol myth, to sell drugs and medications.
Right. Tell me the role of cholesterol on the brain, because it's important for the
It's
brain.
vital for producing memories in the brain. It's vital for producing hormones such as what's called pregnenolone, which is probably the most important hormone for our memories.
So in other words, if you lower cholesterol, then people have lower memories.
Well, interesting enough that statin drugs have been shown just recently in studies, we need cholesterol throughout our body, that in a normal person, they'll increase the risk of cataracts by 50%. In a diabetic, it's 80% because it needs cholesterol for repair
Right.
in our lens. The Women's Health Initiative just came out in January of this year, and it showed that the statins increase diabetes
Right.
by 50%.
Right.
And you're also disabling a crucial enzyme, coenzyme Q10, which a Nobel Prize was awarded for in 1978.
Right.
That is the spark plug of all of our cells and energizes. And the last thing we want to do is de-energize our cells and our metabolism.
Right.
So it's very risky when we start putting patients on statins, which have negligible benefit. The benefits have been grossly and grotesquely exaggerated, and the side effects have been underrepresented.
Once they're put on statins, is it very hard to get them off?
No, not at all, like that.
Is it a wean off or?
No, normally it's not a wean off, and usually people start feeling better quickly. I deal with a lot of athletes in my martial arts center and kickboxers and things like that.
Yes.
You put a statin on an athlete, it'll impair their physical performance very quickly
Right.
because their muscles are so fine-tuned. They know it immediately. They can't exercise as much. They don't have as much endurance.
Right.
Their muscles aches and their energy levels go down.
Right.
And the last thing you want to do is to take energy away from the cells of our body.
Right.
Energy is the currency of our metabolism and healing. So I think it's very problematic. And I'd just like to make one more point on the cholesterol-lowering drugs. they were approved, and it's important not to look at statistics sometimes, a 33% reduction in heart disease. Okay, that's the Pfizer, the Lipitor. What they don't tell you is that they tested, for every 100 people they tested over a period of 3 to 5 years, 3 people on a placebo will get a heart attack.
Right.
If you take Lipitor, it's only 2 people.
Right.
So we went from 3 to 2. So what we should use is, how many people do you need to treat for one person to benefit?
Right.
In essence, you have to treat 100 people to get one benefit,
Right.
but 100 people will have side effects
Right.
and impaired health.
Yeah.
And that's the Pfizer study.
Right.
That's the pharmaceutical saying that's the best case scenario.
Right.
The only independent government study showed no benefit.
Right.
So, I mean, it's very problematic.
Well, we know that it's a multi-billion-dollar industry right
It's
now.
the biggest, most profitable industry and drug ever in the history of the human race. So there's a vested interest to keep this going.
Right.
It's a lot of money to be made to keep people scared, frightened of this word cholesterol. If I go into a senior center and talk cholesterol, I mean, I might as well be talking about Saddam Hussein. People sort of, oh, my cholesterol.
That's true, because you go to the doctors and everybody, they're monitoring your cholesterol level. If your cholesterol level is a certain level, well, we think you should be taking these medications. It's very frightening for people who don't understand.
Yeah, and you know, there have been 3 studies. One just was released this time last year in Norway. It's called the Norway Hunt-2 study.
Right.
And they looked at 57,000 people, and they found that elevated cholesterol, you live 28% longer.
Right, right.
And
Right.
you reduce your risk of cardio events by about 20 to 25%,
Right.
and particularly for women.
Right.
So, I mean, it's dramatic. And we've seen the same thing in Japan and Paris. Elderly women, elevated cholesterol, live longer. So it's very problematic to scare people like this and just to push a drug.
So, okay, we've talked about, say, like the diseases. Now, if they stop taking the medication, but they don't alter their diet, what kind of things would you suggest as a naturopath for them to change?
First, you know, I'm not a medical doctor, so I don't advocate anybody going off their medications.
No,
like
they'd have
that.
to get that with the
Okay,
doctor.
in that respect. But, I mean, I have what's called like a fess up program.
Right,
FESS. You got to fess up. And, you know, you have to change the food plan and not be afraid of fat, and balance fat with protein, and then have what I call low glycemic carbohydrates. You must have an exercise program. I mean, this country is becoming unfit. Recently, the United States military is now rejecting more applicants than in the history of our country.
Right, right.
People are unfit and overweight, and it's a
Right.
tragedy. So a fitness plan is really crucial. And then we need, you know, supplementation can be extremely beneficial and very, very helpful, Cheryl. Other aspects are, you know, don't be afraid of the sun. Don't burn, but get out in the sun and get your vitamin D levels tested.
Right.
And get them up and supplement if you need to.
Right.
Sleep. Sleep is crucial. Stress control. And my goodness, if you have a spiritual foundation, understand that God didn't intend us to have this type of plague on our lives, and we can do something about it.
Okay. So, you know, we have 5 minutes left. I'd like to kind of give them some kind of hope. If they have diabetes, anybody out there with diabetes, can it be reversed?
Totally, 100% reversed and improved, and it can happen from day one.
Right.
You know, it starts with getting out of your house and start walking around the block. It starts with starting to incorporate therapeutic fats, and I'll list them on my website for anyone who's watching this show. Therapeutic fats that stabilize blood sugar. Don't be afraid of dairy and whole fat foods. Try it for 3 months. As soon as I converted back to whole, you know, dairy, my family started losing weight. It
Yeah.
didn't change a thing.
Trust me, I think that advice alone will not have people worried at all, because a lot of people they crave the butter,
Try
they
it.
crave
I mean,
the dairy.
sure, Cheryl. Some
Yeah.
people, of course, are allergic. They're lactose intolerant, but they can have fermented dairy, such as yogurts and kefir, KEFIR, which is a really therapeutic
Right.
Yogurt drinks. Don't worry about eggs. Eat eggs to your content. And I'll post all the scientific data on eggs. Even the Columbia University physician study, 3 to 4 eggs a day has no effect on cholesterol.
Right.
The Framingham Heart Study, no effect on coronary disease. And the Harvard School of Public Health newsletter, no effect on cholesterol levels. So, I mean, start using your wisdom of the ages and start thinking, what did my ancestors eat when they
Right.
didn't have diabetes?
Right, right. Okay. Exercise, you've mentioned exercise briefly. What type of exercise? I've heard weight-bearing exercise is much better for people who are insulin resistant.
It's a combination of getting out there and walking and moving and doing something you enjoy, getting your whole family out. If you're a parent, show leadership. If you don't do it, why would your children do it?
Right.
So set an example for the generations. And also, yes, weight-bearing exercise, because muscle is metabolism, and the more you change your body composition and up the muscle level, muscle burns about 1,000% more calories a day than fat.
Right.
So it's crucial for your metabolism to do comprehensive fitness.
What about sleep?
Sleep is so important because if you don't sleep, you raise what's called your cortisol levels. You're grouchy in the morning, your body needs energy, and interprets that as carbohydrate feeding. So you're going to medicate yourself on a lot of carbs because you haven't slept well.
Right.
So having a good sleep policy is absolutely crucial for weight loss and control of insulin levels.
Can you have too much sleep?
I don't know what too much means.
Right. I mean, there's some people with diabetic, they're tired all the time.
Well,
that's probably low blood sugar.
Could be blood sugar. It's a lot of times it's just lack of the right nutrients. Nutrients and a good food plan and supplementation can change the whole outcome of your energy level.
Right.
You know,
Okay.
it's just that most people don't get that guidance from their doctors because they're not educated on nutrition or nutritional medicine.
Okay. Patrick, thank you very much. I know there's a lot more information you can give and there's a lot more information that you have, but we've run out of time. What I want you to do, just look into the camera and give your address, your telephone number, your website, give information that if anyone wants to contact you, that they can get to you.
Well, I have a new website where I'm posting articles on health from a nutritional and naturopathic standpoint. It's called NutraScienceUSA.net. That's spelled N-U-T-R-A, scienceusa.net. I can also be reached at 203-745-5137. So follow the website and learn. Get a different perspective. I'll be posting articles every week, and I'll have some information on what we've spoken about today, Cheryl.
Okay, thank you very much. That was a very interesting topic. I know there's a lot more. Diabetes is one of my pet peeves because I think it's something which can be preventable.
Absolutely.
And it is something that was created as opposed to something which is natural in nature.
I couldn't agree with you more. Thank you.
Thank you very much.